everyone, and welcome to the Doctor Show. I'm Dr. Zahra, and I will be here every single week to answer your questions, to talk about medicine, and hopefully we'll make it a little bit more fun and understandable. So, let's start a new habit together. Every single week, we want to receive your questions and we will answer them. And anything you might be wondering, any medical thing you've always wondered and you never had the answers to, I'm here to answer. So find us on social media and find the comment section and write whatever you want to ask, and I'll be here to answer. For now, today, we will answer some of the commonly asked questions and questions I've personally been asked before. So let's start with the first question. So the first question, and this question your mom or dad or anyone might have told you otherwise. Is swallowing gum really bad? Does it actually stay in your stomach for a few years until it actually gets digested? Well, is swallowing gum really bad? The answer is no. It's not actually bad if you do it occasionally. If you do it once a while, if you accidentally swallow the gum once every few months, I don't think it's gonna be a problem. Actually, your stomach will digest it just like anything else in your stomach. It will take a couple of days until it actually gets passed down your feces. So the stomach first eats the sugar around it, and then the remnants will go down just like anything else. So does it actually stay in your stomach for a couple of years? Not really. But how are we sure of that? How do we know that it doesn't stay? As doctors, we do something called endoscopy. Endoscopy is something, it's like a small tiny camera. We insert it through the mouth and then to the esophagus, which is the tube leading to the stomach, and then we see what's inside of the stomach. Why do we do it? We do it to check for certain diseases. Also, when we do it, do we actually see a pile of gum waiting for me from years and years? Actually, no, we don't. That's why we're sure that the gum will always be passed down and it will never actually be undigested. But here's the trick. If you actually swallow many gums on a row, like 5 or 6 in a few days, it might actually cause something called an obstruction. It means it will stay in your stomach and will actually close a part of your intestine, especially if it's for children and if they actually swallow other things. Children tend to usually swallow like coins, batteries, and all of that. Imagine with the gum on top of it, that will actually be very bad. So, is swallowing gum bad? It is actually, if you do it a lot, it is bad. But if you do it once in a while, no, it's not. So the next question is, does holding your urine for a really long time cause you kidney issues? Of course, the answer is yes, it does. Because if you hold your urine for a really long time, your bladder muscles will get weakened with time, especially if you do it so often, if you hold yourself, if you can't find a clean bathroom or all of that, or if you're just too lazy to go to the bathroom, your muscles on the bladder, they will become a little bit more weak, and with time, you will not be able to actually hold your urine for long. And with time, there is something called urinary incontinence. It means if you have a pressure down your bladder for so long, you will actually slip some urine out while you're coughing, you're sneezing, anything that will cause you pressure inside. Of course, I'm talking about the long-term effect of urinary bladder when you hold it. But if you do it once a while, if you actually do it once every long while because you couldn't find a clean bathroom or you were on the way in the car, it's okay to do it once a while. There's another health issue about it. When the urine stays in the bladder stagnant for so long, not moving, it will actually make it much faster for it to multiply and become much more. So it will cause you something called urinary tract infection. So your bladder and urethra and all your urinary tract will be more liable to have more infections. So no, please do not try to hold your urine for so long. It is really bad. So the next question is actually very interesting. The question is, does my heart really stop when I sneeze? The answer is a definite no. Because, guys, you have to know that the heart does not ever stop for any reason unless you actually die, God forbid. So, do you really think that when I sneeze, especially if I sneeze like 3 times in a row and all of that, do you really think my heart will stop? The heart is actually an organ that has one function only, which is pump the blood to the rest of your body, which gives it oxygen and all of that. So do you really think we can actually afford to lose the heart to stop once, even every day? That definitely does not happen. But something actually happens. When you sneeze, you're trying to expel something that actually got inside your lung, like a dust particles and anything bad got inside. Just like when you clean your room or your mom's cleaning something old, you have a lot of dust particles in the air and you just keep on sneezing. So your body's trying to get rid of anything inside. So when you do that, your lungs and all the muscles around it, including a muscle called a diaphragm and all of the muscles between your chest, will actually contract together to try to expel it. So the pressure inside of your chest becomes much, much higher, meaning less blood goes to the heart. So the heart will beat a little bit extra to try to pump the blood. So the sneezing does not actually stop your heart, but it will mess with the rhythm a little bit. It will make it beat a little bit extra, and that's it. Again, the heart does not stop for any reason. So the next question is interacting with your pets, like hugging them, petting them, and like letting them lick your face, healthy or not? The answer is, as a doctor, I have to say no. Because you don't know where his tongue actually has been. And actually, if it touches your face for so long, all of the bacteria will get inside of your face. That's actually not healthy. But you have to make sure that the pet is actually very clean, it actually has all the anti-worms and all of the antibacterial drugs and all of that. So we will have a whole episode about talking about your pets and how to raise them and what are the precautions you do to keep them. But there's one trick. When you actually hug your pet and when you let them kiss you and all of that, it will release a certain hormone inside of your body called the oxytocin hormone. Before we talk about it, a hormone is basically a little protein gets released from one of your organs inside of your body to do one certain action. What is the action of the oxytocin? It is actually commonly known as the love hormone, if you've heard about it before. What does it do? It gives you, it's like a fuzzy, love, nice feeling hormone. It gives you this feeling of well-being, of the social interaction with the dog, and makes you feel very warm and nice. So all in all, it does actually have a good advantage. And as a dog person, I would love to recommend to own a pet because it actually has been tested into an It actually has been tested to be an anti-anxiety drug. So it will fight depression, it will make you feel better every single day. But again, as a doctor, you have to make sure not to lick the facial area and your nose, your mouth, and all of that to make sure you wouldn't have bacteria on your face. Again, wait for the episode when we will talk about the pets and owning your pets. The next question is swallowing or spitting the phlegm healthier? Actually, the answer for this one, not a yes, not a no, it actually doesn't really matter. First of all, you have to know what a phlegm is. A phlegm is the extra mucus you have when you cough, when you're sick, or when you're trying to expel something from your lung. So the phlegm is basically extra mucus. You know, when you say someone has a productive cough, it means someone makes a voice while coughing. So when we cough this out, should we cough it out or should we swallow it? Actually, it doesn't matter. If it makes you feel comfortable to spit it out, again, if you decide to spit it out, please make sure you do it in an appropriate place, of course, and it will not even harm you. But if you decide to swallow it, your stomach has a lot of acids and digestive enzymes that are strong enough to kill the bacteria inside of it. So do you think that it could ever cause you harm to swallow it? Not really, it doesn't. So it doesn't matter if you actually swallow it or if you spit it out. The next question is drinking water while you're eating safe or not? Actually, it's definitely safe. Drinking water is actually, of course, one of the healthiest things you should do. And we always see these slogans on social media and everywhere that says, stay hydrated and keep drinking water, remember to drink your water. That's very true. It's true that it's very important to stay hydrated because all the kids, they actually need to drink 6 to 8 cups of water every day. And as for adults, they need 3 liters of water every day on average, means from 11 to 15 cups of water every day to stay hydrated. Because our body is formed of up to 60% of water, so we need to keep sure that to actually stay hydrated all the time. But let's get back to the first point. Is it healthy to drink while I'm eating my food? Yes. Some people, they say, do not drink a lot of water because it will dilute the digestive enzymes that you have in your stomach. That actually is not true at all. On the contrary, it will actually help you and aid you to digest better and to swallow your food better. It will help you not to get choked very easily. And not just that, it will make you feel full a little bit too soon or a little bit sooner than you should. So it will prevent you from overeating. So drinking water while you're eating is very, very healthy, and please make sure to do that. Even before you eat is also healthy. So please remember to always stay hydrated. So the next question is picking your nose really bad? I'm sure we all know the answer to this question. It's a definite yes. Okay, so it's healthy to clean the nose once in a while, but we have to do it in a proper place. We have to do it in a clean place. We have to do it with a wet tissue and all of that to make sure your nose is not blocked and it's actually clean. But if you do it as a habit and you do it occasionally when you don't actually need it, that's actually not healthy at all. Because the tissue inside of your nose is much more sensitive than the tissue on the top of your nose. Okay, it's actually much more sensitive, so it's more liable to trauma. It means it could actually cause you nosebleed, and the nosebleed is not so easy to actually stop. So please make sure not to harm yourself while you do that. And of course, it does not look good at all when people do that in public. And there's another thing. When you actually touch your face, it's another thing to give your nose more bacteria. You know, when we always say to prevent actually having COVID-19, we say do not touch the face. Touching the face does not actually only means the mouth, it actually means the nose as well. So imagine if you pick your nose all the time, you don't just give the bacteria, you actually insert it inside and make it so much easier for you to just inhale it. So it's another thing to have precautions against COVID-19. And by the way, COVID-19 is not the only thing that can get transmitted by air droplets. A lot more viruses and bacteria like common cold and flu, they actually get transmitted through that. So imagine you causing yourself that because you just picked your nose. Also, not just that, in order to actually stop this habit from happening, we usually have a simple of a solution. What do? We tell the patient or the person who has the habit to put a band-aid on his tip of his finger, so whenever he tries to actually pick his nose, it will prevent him and he will remember that is a bad thing. So if you want to stop picking your nose and if you do it out of habit, please try to put the band-aid idea and let's see how it goes. Also, please do not ever go from the nose to the mouth. Not acceptable. What about the last question we have? The last question we have is actually very controversial and people talk about it the whole time. So, does chocolate actually cause acne? The answer is no. Yes. Are you sure? Yes, I am sure it's no. Because it's not that simple, guys. Acne is not that simple at all. It's something happens because of many factors. It's something called multifactorial. It means it has many factors to cause it. So can we actually say chocolate equals acne? We can never say that. Things are much more complex than that. But there's one thing. The sugar around it has something called pro-inflammatory response or pro-inflammatory action. What does it actually mean? It actually means that it's more liable to make inflammation. Okay, like the high glycemia in the blood, it means the high blood sugar, it's more liable to cause inflammation. That's what the studies always say. So sugar is actually bad, not the chocolate. It means if you actually eat dark chocolate, like pure dark chocolate, it will never cause you acne. It's a healthier snack than having sugar. And the sugar actually makes you more liable to make something called a sebum. A sebum is the oily, waxy thing that makes the acne appear. We will have a whole episode to talk about acne and adolescent acne and what causes it, but it's definitely not only chocolate. And I always hear that. My friends, they be like, I don't want to eat chocolate because it will cause me acne. That is not true at all. These are all the questions that we have today. If you have more questions, please do not hesitate to always find the comment section in our social media and ask whatever you've been wondering about medicine. Thank you very much for watching, and I'll see you next Tuesday. Have a good day.